Okay, so you've been allergy tested and now you know. You have an explanation for your symptoms. You've got bad allergies. So what are you going to do about it? You started this whole process because you want a better life. At the Modern Nose Clinic, we really want you to have the best quality life possible. That's why we want to talk to you about Smart Care for Allergy. First, I want you to imagine a day where you're miserable. It's a miserable allergy day. And I want to ask you how many dollars you would spend to have relief that day. And I just want to share with you, I drove with the minivan through Starbucks with my family, and it was hard to come out of there without spending $5 per person, and that was gone in like 30 minutes max. So would you spend $5 or maybe $10 to have a symptom-free allergy day during that peak of your allergy season when things are absolutely miserable? So you picked a number. We'll say $10. The second question is, what percentage of the year are you affected? And everyone's different, and we're going to offer you this calculation. You can do it yourself to get it just right. But is it all year long that you've got allergies? They're indoor allergies. They're the dog, the cat, dust mites. You can't get away from it. You go to work, whatever. Or is it just seasonal? When I say just seasonal, that could still be most of the nice months of the year. Some people start in spring and they go right through to fall. So it's even the best time of the year when you really want to be outside. So let's just, to keep it simple, let's just say that 50% of the year, you're impacted by your allergies. Next question is, how old are you? And we have been, with our mathematical modeling, saying that people in this day and age will live to be 100. That's the way things look like they're going. So take 100 minus how old you are. So I'm 52, so 48. We'll do this one for me. The next question is, if someone asks you to do something you didn't really want to do, but you could do, like say work, your job. Maybe they say on your day off, on Saturday, will you come in and do an hour of work? How much would you need to get paid in order to do that? I need to kind of know that for the calculation also. Okay, you can change these numbers, but you'll see what I'm doing here. So $10 you would pay to have a symptom-free day when you're otherwise feeling miserable or under the weather, so you can really live your life the way you want to. And it's about, we'll say, half the year, and you can change this number also, 180 days, so that would be $1,800 per year is how much you would value having a normal life. So we're using me again, so 100 minus 52, I'm going to be alive 48 years. You can pick however many years you think you're going to be alive, times $1,800 a year gives you a grand total of $86,400. Now, mind you, you're just suffering through this, and you don't need to. You ask questions like, why do other people accomplish so much more in life? Why are they happier? Why don't they struggle so much like I do? It could be things like allergy holding you back. So just from a quality of life perspective, if you were to do Smart Care for about 2 or 3 years, and it's $100 a month for an adult male, for a small adult or a small female, it could be $75, and for children, it's $50. So we're talking, at a max, $100, $1,200 times 2 years, $2,400. Throw in 3 years, $3,600. Then the rest of your life, you get to live symptom-free. So from a cost perspective, it is worth it to invest in yourself. Okay, Dr. Scarata, I want to live a better life because I see my friends doing great and I'm not, and I wonder how people accomplish so much in life, and I see that I'm miserable. I keep just putting up with the fact that this is just another miserable day. Oh well, I take pills that don't really work well, and I'm pay money for them also. On top of it all, that's not even in the calculation. How much you pay per year for allergy medications, the Afrin, the Sudafed, the Azlastine, the antihistamines. Research says you're paying $5,000 every 10 years for that kind of stuff. So when you say to us, well, what is the least expensive way to go? It is definitely Smart Care for Allergy. Oh, you want to use your insurance. You want to do a shot clinic. Remember that calculation I told you earlier? So you value your time at $20 an hour. I'm going to come in, I'll work on Saturday, give me 20 bucks, we're good. It's cool, I'll take care of it, no worries. Okay, we're going to ask you to have 1 hour of your time every week for 5 years. An hour of your time is about $1,000 a year. Coming in an hour of your time once a week for that whole year. So $1,000 of your personal time when you go to have the insurance pay a fraction of your medical care, right? And so what are they paying? Oh, do you have a deductible? We have like $1,000 deductible. So First $1,000, we're paying for it before it kicks in, the insurance kicks in. So you're already paying $1,000 a year, not even to mention your personal time, your quality of life, all these other variables. With Smart Care for Allergy, you get better faster because you put the drops in your tongue for 1 second at home. So you do it 7 days a week, 365 days a year is 365 seconds. And so you're exposing your immune system more frequently. So you're educating your immune system faster. It's like practicing the piano every day. You'll learn faster than if you practice it once a week when you sit down with the piano teacher. Ask me how I know that. I've got kids. But anyhow, what I would say is that we so badly want you to have that better life. We want a higher success rate. We as an organization, we make more money with Shot Clinic. We make 3 times as much money with Shot Clinic. And people convert because they say, oh, it's covered by insurance, and their brain turns off. We want to turn your brain on. You want to get better. You want to have the safest treatment, the most convenient, the highest success rate, the quickest. You'll get better twice as fast on average. You want Smart Care for Allergy. So what are you waiting for? Why don't you sign up today?